Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, and welcome to our afternoon press briefing for Wednesday, May the 20th. Since our press briefing yesterday afternoon, we have had 111 new cases of COVID-19 reported today in Montgomery County, which brings us to a total of 6,126. 17 of these cases are from long-term care facilities and 94 are from the community. These positive individuals are from 32 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. These individuals range in age from 4 months old to 99 years old. And as always, you can check our municipal maps for updated information at montco.org/COVID-19. Today we have 56 females and 55 males. None are known to be hospitalized. 4 are known to be at home in isolation, and the remainder we do not have information on. I'm also saddened to confirm that 12 more Montgomery County residents have lost their lives to COVID-19, which brings us to 548 deaths confirmed positive from COVID-19. 5 passed away in a hospital and 6 at a long-term care facility. 1 we do not have information on. They ranged in age from 66 years old to 95 years old. Overall, since the pandemic began, 298 females and 250 males have lost their lives to COVID-19. The self-reported racial breakdown: 13 Asian, 3 Asian Indian, 2 Asian Korean, 59 African American or Black, 161 white, and 310 we do not have information about. In terms of probable deaths, and these are deaths defined as COVID-19 listed on the death certificate, but we do not have a confirmatory lab test. Today, we have 179 probable deaths added to our confirmed 548, gives us a total of 727 probable or confirmed deaths from COVID-19. And as I mention every day, this probable number changes quite a bit. If we do get a confirmatory test, which we often do, then that number moves into the confirmed positive count. In terms of our hospital beds, today the number of hospitalized patients is in the low 260s, which is an increase from 2 days ago when we were down to 250. Approximately 24% of these individuals are requiring a ventilator. We have continued reporting on our long-term care facilities. 94 facilities are reporting positive cases of COVID-19 among their staff or residents. And today, and remember, this is a cumulative total of self-reported cases from these facilities. We are now at 1,734 cases among residents, 628 among staff, for a total of 2,362 positives. And as just a reminder, these are not all Montgomery County residents, so these are not part of our overall count, but our daily reminder of the ongoing and serious situation that is being faced by many of our long-term care facilities. Happily, though, and hopefully in part due to our FAST teams, we are starting to see those new case numbers starting to come down, which is really good news. We have from long-term care facilities 479 of the 548 confirmed positive deaths of Montgomery County residents. So 87% of our total confirmed positive deaths are individuals from long-term care facilities. We continue to do outreach. Our FAST team this week has, I think, 7 revisits scheduled, as well as 3 visits to new facilities. They continue to provide feedback, answer questions, assist with personal protective equipment, advise on infection control guidelines, and work with the facilities to help them facilitate mass testing, connecting them to labs that have tests available and other opportunities like that. At the Montgomery County Correctional Facility, all inmates that have tested positive for the coronavirus remain stable. In our community testing sites, the Norristown walk-up site was open today and should be open both tomorrow and Friday, weather permitting. The Norristown site will be closed Saturday, Sunday, and Monday for the Memorial Day holiday. Many thanks to Delaware Valley Community Health Center, Dr. McNeil and Dr. DeJoseph for your wonderful partnership in this work. As I've been reminding you this week, the testing site in Norristown has expanded their criteria to include all residents of the municipality of Norristown, as well as all established patients of the Delaware Valley Community Health Center, regardless of the municipality in which you live. If you would like to make an appointment for the Norristown site tomorrow, if you meet one of those criteria, you can call at 8:30 tomorrow morning, 610-592-0680. That's 610-592-0680, and that's only for Norristown. Our Montgomery County Community College site is back open today. It's a little less windy today and up and running smoothly at Montgomery County Community College. Many thanks to Whitpain Township, the Whitpain Township Police, the Pennsylvania National Guard, and all the folks from the county that are out there helping. For the dates of April 16th through May the 15th, we have now tested 5,855 individuals, and we have received results on 5,707, which represents 97% of the total. 793 of these individuals have tested positive. For 25 days of testing at this site, we are overall running 14% positive. But I would like to make one comment on these results. I want to point out something that I see every day, but you don't necessarily. For the individuals who were tested on the dates of May 7th, 8th, 11th, and 12th, the positivity rates were below 10% each of those days. So that was 4 testing days in a row. For individuals tested on the dates of May 13th, 14th, and 15th, the positivity rates were between 15% and 19%. As I also noted above, we have seen a slight uptick in our hospital admissions. These 2 data points serve as a reminder that we remain in a situation where there is still very real risk of virus transmission in our community. Please continue to stay home as much as possible. And when you are out in public, follow the social distancing guidelines. Wear a mask to protect others. Cover your cough or your sneeze. Wash your hands with soap and water or use hand sanitizer as frequently as possible. The appointments for the drive-through testing site at the community college will open for Thursday, tomorrow morning at 8 a.m. Appointments can be made at moncopa.org/COVID-19 under the green County Testing Information button. Or you can call 610-631-3000, also beginning at 8 a.m. tomorrow morning. I do want to announce that the site will be open this Saturday, but will be closed both Sunday and Monday for a safety stand down and in observance of Memorial Day. So this month is Older Americans Month. Every May, the Administration for Community Living leads our nation's 84th Observance of Older Americans Month. The theme for 2020 is Make Your Mark. This theme was selected to encourage and celebrate our countless contributions that older adults make to our communities. Older Americans have built our economy, defended our nation, raised our families, and dedicated themselves to improving the quality of life for future generations. They have sacrificed in times of hardship and took pride in a job well done. They pour love into their extended families, places of worship, and neighborhood centers. Fortunately, as you all well know, older Americans are also among the most vulnerable to the ravages of COVID-19 and face the hardships of loneliness and social isolation due to social distancing practices and the inability of family to visit. This year highlights the difference every one of us can make in the lives of older adults, in support of caregivers, and to strengthen our communities. During this time, please remember to treasure our older adults who are in nursing facilities and who are living alone, and do what you can to support and care for them. Montgomery County remains one of the oldest counties in southeastern Pennsylvania, with almost 18% of our population being over 65. Last week, we would have been hosting two of our most favorite events here at the county, the annual Montgomery County Senior Games and the Centenarians Lunch, which celebrates all of our seniors that are 100 years of age or older. However, like many events, they have been postponed until a date in the future when it is safe for us to all join together again. In the meantime, the Montgomery County Office of Senior Services will be celebrating our centenarians throughout the month on the Montco Health and Human Services Facebook page at HHS Montco PA. So again, that's on Facebook, HHS Montco PA. So please check out these interactive posts and celebrate with us. Senior Services home delivered meal providers are continuing to meet the need of approximately 670 homebound individuals who would otherwise not receive proper nutrition. RSVP has distributed 1,100 surgical masks to seniors in the community. And the Montgomery County Office of Senior Services is providing wellness check-in calls several times a week to over 100 seniors through a partnership with Arcadia University. And thank you, Arcadia, for that wonderful partnership. I might add that the people who are delivering many of these meals, volunteering in food pantries, grocery shopping, running errands, and providing wellness checks are seniors. And we are showing you some of their pictures in the photos that you see scrolling on the screen. Although our senior centers are currently closed, they are providing support groups, book clubs, health and wellness classes online, and other activities, all virtually. I want to thank the Montgomery County Office of Senior Services for their commitment to serve our precious seniors, and Health and Human Services and the Department of Public Safety for supporting our efforts to protect our most vulnerable seniors in our nursing homes during the COVID-19 pandemic. And with that, we are ready for questions.
Who goes first?
Our first set of questions will come from Deanna Durante from NBC 10.
I'm good.
Okay, no questions from Deanna. Next, Todd Shepard from the Delaware Valley Journal.
Thank you. Madam Chair, on May 6th, you spoke to the Democrat Senate Policy Committee, and you talked about the county's growing awareness that nursing homes were a crisis point. And twice you assumed that the Department of Health would take care of a certain situation, and twice those expectations weren't met. Was it wrong for Montgomery County to have made the assumptions, or were the assumptions more or less correct, but the Department of Health failed to rise and meet the situation?
Well, the situation that we found ourselves in with this pandemic is, as you know, a very rapidly evolving situation and continues to be rapidly evolving. Going into this pandemic, we were well aware through our Office of Public Health that the Pennsylvania Department of Health is the licensing and regulatory agency for about 70 long-term care facilities here in Montgomery County. And we did assume in our initial planning that the Pennsylvania Department of Health would be the primary entity that would respond to unmet needs in those facilities. As the weeks went by and the situation began to escalate, we did come to understand in conversations with the Pennsylvania Department of Health that their capacity at that moment was going to be limited to being able to do phone consultations. They did help provide personal protective equipment to the county, which we ended up helping, happily so, to distribute, but they were not going to be able to provide any on-site teams. And in some of our facilities, it had become apparent to us that we thought they needed some help, hands-on help in the facility. And so it was at that point that the county formed our FAST teams, which are teams of 2 that have been making visits to many of our facilities. At this point, I think they've made a total of about 77 visits, providing guidance and other things, as you heard me describe earlier. Any other questions?
A question from Carl Hessler at the Pottstown Mercury. Earlier this week, you said that the Pennsylvania Department of Health, in collaboration with the Federal Centers for Disease Control and Prevention, will be deploying strike teams for a comprehensive assessment to a small number of long-term care facilities. Can you identify those facilities, and have the strike teams arrived?
So the facilities have been identified by the state. I believe there are 4 of them in our county. I do not have the names in front of me. It is my understanding that those facilities were chosen by Pennsylvania Department of Health because they are facilities that appear to have just a few cases. And I think the thinking is, you'd have to confirm this with them, but that by getting a team in there early, they might be able to prevent a large number of cases occurring in these facilities. I heard from my team today that they had received an email or a call today that the CDC teams are in the state and that they are hoping to schedule visits soon. I believe they said next week. And some members of our FAST teams are going to accompany them in an observational status. So we're hoping that we can provide local knowledge of the situation here on the ground in Montgomery County to the teams from the CDC. And our team is looking forward to learning about any best practices or other new information that we don't currently have at our disposal. So I think it's going to be just a win-win opportunity for everybody involved.
Another question from Carl Hessler. Has the county hired and trained its contact tracing teams? And has a date been set for when contact tracing will begin again in the county?
So yes to both. We have actually already started some contact tracing through our Norristown-based community testing site. And that anyone tested at that site, we are now able to do contact tracing. We have hired part of the leadership team for our new contact tracing team. And individuals are starting next week. And we are also redeploying some existing staff to that team. So we are hoping that by next week, we will be able to test hopefully by midweek or Wednesday, Thursday of next week, 50 people a day. That's where we intend to start. And then we intend to quickly ramp up from that to whatever is required.
A question from Kevin Tierney at Burb Media. On Monday, the Philadelphia Inquirer reported issues with the instructions that came with mail-in ballots. The county's website and social media accounts do not address these issues or provide any clarification for voters. When did the county realize there were mistakes in the instructions? Who's in charge of proofing the materials, and why haven't the issues been publicly addressed?
I'll take that as chair of the Board of Elections. It was a mistake in voter services. It shouldn't have happened. It's been corrected on all ballots that are being sent out. The proper instructions have been posted on the voter services website. And it's a good idea to put out some social media on it as well. But the mistake has been corrected.
Thank you. There's no more questions.
This is Todd Shepard with Delaware Valley Journal. May I have a follow-up question, please?
Sure.
Madam Chair, at the same committee meeting I referenced earlier, the May 6th, at the Democrat Senate Policy Committee, Chester County State Senator Andrew Dinniman said, there is no excuse for what is going on, okay? The Department of Health has failed our nursing homes. How would you characterize the Department of Health's response to the nursing home crisis in your county? And do you have full confidence in Health Secretary Rachel Levine?
So I can't speak to the situation in Chester County, but here in Montgomery County, we have had a very collaborative relationship with the Pennsylvania Department of Health. Every time I have reached out to them and asked for a phone call to discuss our situation, we have quickly gotten that call scheduled. We've had very, in my view, helpful and honest conversations with one another, particularly around what the Department of Health was or was not going to be able to provide to Montgomery County in the kind of immediate next few days type situation. So overall, it has been a good relationship and a collaborative relationship, and I do have very good and strong confidence in Secretary Levine. Any other questions?
No more questions.
Okay, great. We will see you tomorrow at 3.